the context of the project is all about trying to use data better. We know that within healthcare organisations or organisations conducting health research, there's an enormous amount of data. Local authorities, universities, local NHS organisations all collect data in order to try and help improve their understanding of the need for services, the delivery of services and the effectiveness of those services. But the question that we're trying to challenge ourselves with is to ask, are we really making the most of that resource to serve the people of Bristol as well as possible? And we think we could do better, and we've partnered with the EBI to try and do some initial work to try and get us started.
That's brilliant. So how exactly is the project going to work?
It's a very big challenge, using data more effectively, really making the most of the research value of all the data that we share. And so we decided to focus on developing as good an understanding as possible about the data that we actually hold in the organisations that form the partnership. And so we've done effectively what is a mapping exercise to try and put together the first version of this data inventory, which kind of describes what our collective data resource looks like at the moment. It tells us what data is held about what subjects and where in the organisations that make up the partnership. This is also relevant because there will be new legislation and regulation next year which requires information asset registers to be held and for those asset registers to be accurate and reliable. And so, as well as forming something which we hope will be useful for our community, this is also a piece of work which will help with that regulatory requirements in the next 12 months.
Mm-hmm. And can you tell us a bit about how the tour that we're going to see today is going to work?
Yes, of course. So we tried to put together a video which gives a bit of an overview of the structure of the inventory, and then using 3 practical examples shares information about how it might be utilised in practice and what someone using the inventory might see as a kind of user. And what we're hoping to do today, and when this goes online, is to share the basic structure of the inventory with people and to ask them for feedback to help us understand how might they use it and how could we improve it.
Okay, well, let's dive in then.
Let's start by showing you what the inventory looks like. You'll see that it does not contain any information about individuals. It lists the names of data sources and gives a brief description of what they are. This simple document is the first picture we have of our collective data resource. We will be adding more descriptive labels about the data sources listed in the inventory to help users get information quickly to see what they might use for research or service planning projects. To go deeper into the inventory, we'll use a prototype web-based technology called NewMap. Modest development funds have been provided to the local team that have produced this as part of the project. There are 2 interfaces in NewMap. This 2D one allows you to drill down into the information. A 3D version gives a top-level overview as what is held on different topics or categories in the inventory. Here's everything stored in the current inventory that relates to health data, and I hope that this reinforces just how much potential there is in our region. Let's now look at the number of information sources the inventory holds about acute care. What you're seeing here is a regional overview of the systems being used and the data sets stored in our hospitals. There are over 250 sources of data shown here. After following the rules that govern access and use of information, we want the inventory to be a gateway that allows our region's brightest researchers, service planners and clinicians to use the information held across the health system to give us insight into the health of our region and how we might improve it. Let's go back to the main 2D view to look into a specific clinical area. About 1,250 people in Bristol have a renal condition so severe that they need dialysis or a kidney transplant. We can use the inventory to tell us about the data sources which are relevant to this area. It shows us the UK Renal Registry database, which is overseen by local clinicians. We get further insight by seeing the data system used to store information about patients with renal conditions in our area. We can build a picture through the inventory of the types of systems and data sets we might need to interact with if we want to investigate more about local renal conditions. Let's move on to a final example. Air quality is a key issue in Bristol and other cities, and we can search the inventory for information sources with that tag. This shows us that the Joint Strategic Needs Assessment has got information about this issue. The inventory also points us to where we would need to go to access this information. It's also giving us a range of other avenues to explore. Note that we are not getting the data itself here, but being signposted to where the data is held. We want to make sure that the labels in the inventory tell people what they need to know about the data sources, and work is underway to develop these labels and make a resource that can be used by a wide audience. Thank you for watching this tour of the first version of Bristol's Health Data Inventory. We've shown how the inventory is developing to include a wide array of information to steer users towards new sources, projects and ideas. We hope that you agree that we've made a start on an ambitious and worthwhile project. As we begin to understand the nature and potential of our collective data resource, we want to build relationships between people with a shared interest in using this resource to improve health and well-being. Our vision is that researchers, health professionals, policymakers, service planners, information governance leads, patients and citizens will use the inventory to enable new work, better project design, improved data stewardship and ultimately better health for the citizens of our region. We are creating a resource for this community and we would like to know how might you use it and how can we make it better. We look forward to hearing from you.